Distinguished guests and colleagues, I'm Dr. Mark Šprenger, Director at the European Centre for Disease Prevention and Control. I would like to welcome you today to the 7th National Meeting of the Initiative for Health and Vaccination in Sofia. I would have really enjoyed to take part in your important meeting today, but due to previous commitments, it's unfortunately not possible. Last year in April, during the European Immunization Week, I attended the 5th meeting of this governmental initiative, and I saw your commitment and dedication to advocate childhood vaccination. I also saw how challenging it can be to reach the so-called hard-to-reach population. And that's why it's crucial that we maintain our efforts and initiatives and join forces in the aim to fight vaccine-preventable diseases and to advocate childhood vaccination. Measles is a highly infectious disease, and contrary to what many may think, it's not harmless and can in fact lead to serious complications. Around 25% of those affected with measles need hospitalization due to complications such as pneumonia, but also due to very high fever in young children. We are seeing a resurgence of measles outbreaks in the EU. In 2010 and 2011, I know Bulgaria experienced several major outbreaks of measles, affecting in particular the Roma populations. And this spring there was a large outbreak in UK and Wales with over 1,300 cases. It affected mainly young people that had not been vaccinated. And currently the Netherlands is experiencing a large measles outbreak, mainly among the hard-to-reach religious population. Though the estimate figure of this measles outbreak in the Netherlands is about 1,400 cases, there are indications that this is a substantial underestimation. Maybe it is 10 times higher. Also, Romania has been greatly affected by measles, as well as Italy, France and Germany. Now, the health effects from contracting measles are huge, and measles is therefore still a threat to public health in Europe. The good news is that measles is a vaccine-preventable disease that can be eliminated. The WHO has set the goal to eliminate measles in Europe by 2015. I was so happy that at the regional committee meeting in Izmir in Turkey, this was again supported by all the member states. To reach elimination, we need a vaccination coverage of 95% of the population with 2 doses of MMR vaccine. But the outbreaks of measles across Europe in recent years are a sign that immunization programs are not reaching all children, that immunization programs are not working optimally, and that pockets of unimmunized populations exist. And that's why I am pleased that ECDC is supporting the pilot project Let's Talk About Protection, where 4 member states, you, Bulgaria, Romania and Czech Republic and Hungary are working in close collaboration to increase vaccination uptake among the hard-to-reach population. I would also like to seize the opportunity to thank our Bulgarian colleagues of their good work in this project and to say how pleased we are of the collaboration between the National Institute of Infectious and Parasitic Diseases in Bulgaria and the Health Mediators Network. Fantastic! I believe you will hear more about this project later during this conference from our Bulgarian colleagues. And in October this year, we will also be supporting the first pilot intervention study which will take place in Bulgaria. Allow me to end by saying a few words about the current financial crisis in Europe. We are experiencing challenging times, with public health spending being cut in many European countries. This means that we need to find new, innovative ways to tackle the outbreaks of measles in Europe. It means showing that engaging with underserved populations is a sound health investment. And it means calculating the cost of inaction, doing nothing, in terms of avoidable illness and hospitalization and death. Your meeting today is very important. It brings together government representatives, NGOs, national experts, general practitioners, the private sector and the health mediators from several countries to share experiences and best practices. This collaboration is the basis for an innovative collaborative model to fight vaccine-preventable diseases among hard-to-reach populations. And I hope that the good practices from this meeting can serve as a model to other EU countries. I wish you all the best for your meeting today. I'm sorry that I can't be with you. Thank you.